It's imperative that we came together and heard directly from the experts on what is happening or what is going to happen from the HR 1 impacts to California and what providers are seeing as a result of both HR 1 and the raids. So excited to be hosting here with my co-chair.
Policy changes in HR 1 is projected to result in tens of billions of dollars in reduced federal funding over the next decade and substantially reduce the number of Californians with health insurance.
HR 1, as noted earlier, makes sweeping changes to the Medi-Cal program and will cause widespread harm by making massive reductions in federal funding and potentially cripple the healthcare safety net that all Californians depend on.
For service, what does that actually translate to? What does that look like?
Unfortunately, for some hospitals, it's probably too large of a gap for some hospitals to remain open.
This law federally defunded Planned Parenthood. Congress did this by cutting off federal funding to pay for any services in Medicaid provided by a prohibited entity. This nearly exclusively applies to Planned Parenthood health centers. The Medi-Cal system cannot fully absorb the reproductive and abortion healthcare needs that Planned Parenthood provides if Planned Parenthood were to no longer exist in the state.
Is there a scenario where we create a state program to fund these kind of reproductive health, gender affirming care, health insurance for the UIS population?
We've been working very closely with Planned Parenthood, just the ups and downs of the last few weeks of it's defunded, we have an injunction, so really trying to think through options to ensure services are still available.
This is a public health impact of the raids. Anxiety, depression, fear, isolation, and lasting trauma. Children lose role models and stability, and elders feel abandoned. Raids create a ripple effect that weaken the health and resilience of entire neighborhoods.
ECE spaces and K-12 schools are amongst the most important environments for building this well-being. When immigration enforcement reaches into or near these spaces, it undermines every protective factor that children rely on. In Los Angeles, a 15-year-old disabled student was mistakenly detained at gunpoint by Border Patrol agents near his high school, an undoubtedly traumatic incident that highlights the dangers of enforcement near school zones.
About a couple years ago, California was ranked 44 in terms of 0 to 5 kids going to see their pediatrician. And I'm wondering if we're hearing that now of undocumented parents not taking their documented kid to see their pediatrician during this age.
Yes, we're hearing not just fears of going to doctor's appointments, but also fears and anxieties when seeking legal services as well.
So we developed a program called Healthcare Without Fear, where we send doctors and nurses and medical assistants to the homes of our patients to provide on-site healthcare services. We're also delivering their medicine. Many families were afraid to go to the grocery store or didn't have money to buy food, so our doctors are bringing bags of groceries with them as well.
I know we're going to continue to have ongoing long-term impacts, both to the children of families detained and to those detained as well. There is a public health lens, an umbrella to these raids, and we thought it was important to bring that conversation forward. So thank you so much for your participation.